Hi, this is Dr. Sam Spear. I'm a board certified plastic surgeon in the Chicago area. Facelifts are so different nowadays. You don't have to get the facelift we were doing back in the 70s and 80s anymore. Facelifts are more about looking natural, being proportional, and looking like yourself, but a little bit better. Most surgeons are sadly lifting people in only one direction, still using drains, and doing some of the older techniques. I think half of the facelifts I do are revisions of other people's work, most of them, of course, not being done by real plastic surgeons. The newest trend of going out of the country to get cheap cosmetic surgery in Mexico or Turkey or one of the other spots is a pretty disturbing trend. I would really urge you to get 3 different consultations and then look at a lot of the before and after pictures. Make sure you're not just seeing the best results that they have. Make sure they're showing you what you will look like the next day, a couple of days later, a week later, 10 years later. All this is very important. With my mini facelift alone, that takes about 30 minutes, can be done in the office under local anesthesia, where the patient gets no drains, no outside stitches or staples, usually takes no pain medication, can shower the next morning and go out. Patients get lifted in 3 different directions. This results in a more powerful and natural facelift. If patients also opt to have some work done on their mid-face or their neck, it's very common to get lifted in 8 different directions with long-lasting absorbable sutures on the inside. We are shaping things on the inside nowadays, not just pulling the skin and telling our patients that they're going to look weird and they'll have to wait a year to look normal again. Filler fatigue, thread lifts that don't last are, of course, other things that cause complications, and they're real threats. The proliferation of Ozempic and Wegovy has its own set of issues to address with facial deflation syndromes. Much like preventive Botox, the idea of a preventive facelift seems like an oxymoron, but most experts would agree that doing a facelift in your 40s versus your 70s will usually come with an easier recovery and a better result. Bottom line, facelifts are so different nowadays. So I would urge you to come in for a private consultation and see if this is a fit for you. I hope you guys enjoyed this vlog, and if you did, please like and subscribe below, and I hope you have a great rest of your day.